The point is, don't give up. Try mo lang. Kasi you never know kung para sa'yo. I know people nga, like I said, diba kanina, people who try 2 times, 3 times, they really didn't give up. Kahit some people are saying, maybe you should move on, maybe find another specialty. But if you really want it, I think you should really try and fight for your dreams. Kasi nga, like I said, those people who I know na 2 or 3 times, ngayon, derma na sila. No regrets, diba?
Do you think it's worth it now that you're a diplomate?
I get the point naman of a lot of doctors. Ngayon, diba, hot topic yun na parang residency is very toxic, ganyan. I mean, it's true. Kahit sa derma may ganyan. I'm not gonna sugarcoat it. It's mahirap. But I guess if you can find an environment that is best suitable for you, kasi mafe-feel mo naman din yan sa pre-res, if okay yung residency training area for you, then maybe you can take a chance. Ako personally, I won't say na madaling derma experience ko. There were times I wanted to quit, derma pa yun, pero I kept going. So what helped me was, one, a very strong support system with my family, and of course, knowing your why.
Welcome to the Homegrown Podcast, where we shine a spotlight on inspiring stories from respected professionals, creators, and community leaders. The show dives into real talks on career, growth, relationships, and the hustle of building something meaningful. Whether you're chasing your passion or navigating your path, the Homegrown Podcast is here to motivate, represent, and remind you greatness can start right at home. Today, we're joined by someone who's helping people become more confident in their own skin. Our guest is Dr. Verne Espiritu, a board-certified dermatologist, physician, and entrepreneur. He recently became a diplomate of the Philippine Dermatological Society after completing his residency at the Skin and Cancer Foundation, and now practices at Verne Espiritu Dermatology Clinic. So from graduating from the Ateneo School of Medicine and Public Health to publishing research on the distribution of dermatologists in the Philippines and advocating for better access to skincare, Dr. Verne represents a new generation of Filipino physicians who are redefining what it means to make a difference. So today we're answering some of the biggest questions about skincare, from acne and hair loss to sunscreen, men's grooming, skin allergies, and the skincare trends everyone's talking about. We'll also tackle common myths and misconceptions and help you understand what actually works straight from a dermatologist. So again, please welcome Dr. Verne Espiritu.
Hello, thank you, Doc Miko. Nice to be here. Thank you, guys.
So thank you for accepting yung invitation ko for being
Thank you for inviting me as well.
podcast. So again, si Verne is my batchmate.
Yep, mag-batchmate kami sa Ateneo. Di ba parang kailan lang?
PH, yeah. So I invited him because I've seen yung mga content creation niya the past few days, and he's been going through my newsfeed, lumalabas siya, and nakikita ko na the algorithm is showing him to me. So maybe fate na ma-invite ko here in the podcast. And I saw kasi yung similarities natin from starting your own clinic and also your family clinic, and starting our own family clinic also in Tuguegarao. So to start our podcast, I would like to ask lang kung how is a day in the life of Verne Espiritu as a new dermatologist?
How do I explain this? I mean, it's very busy, like after passing the boards, of course, I was already setting up my clinic. So a backstory lang, the Verne Espiritu Dermatology Clinic was my parents' clinic kasi they were an OB and they were a pedia. But then of course they retired and they said, okay, ikaw na lang anak yung mag-manage. And I'm an only child, so syempre pressure. But again, I took on the challenge and now I established the Verne Espiritu Dermatology Clinic. So on the regular days, of course, I would wake up. Actually, I'm a one-man team. So, I'm my own secretary, I'm my own security guard, ako yung taga-linis, ganyan. As early as mga 8 o'clock, 7 o'clock, I would wake up already to start cleaning the clinic, to start fixing the parking, like that. By 10 o'clock, of course, we will be open already. When there are patients, I would, of course, attend to them. I would educate them, give prescriptions, and etc., etc. Aside from this, in between, I would also, for example, if there are teleconsults, I would also talk to my patients, no? So, I'm a type na talagang, sometimes, some people might say, oh, tagal lang consult mo, parang 30 minutes to 1 hour. I'm the type who's very madaldal. I really want to explain to my patients the mga things that they want to address, especially since dermatology is a very complex topic, and we know there's a lot of things online, especially for mga skincare and whatnot. So it's important to explain to them so that they can also be properly informed and educated on their own ways to empower their skincare routines and all those other things, of course. So usually my clinic would be until 7 p.m. and then I of course still close everything, pack up. By the time I'm done, of course after the mga dinners, I would start planning already. I would also make my mga content. So I also film my own content. So one-man team talaga. I would set up my tripod and my ring light, and then I would start recording, and then I will also edit that, and then of course I'll schedule it. And on top of that, I also do the promotions of my clinic. So everything you see in my page, I have a Facebook page kasi I also have the Facebook page for the clinic. It's all me lang talaga. Kaya it's so funny kasi sometimes people would ask talaga sa clinic, then nag-inquire sila, hindi nila alam ako pala yun, yung kausap na nila. But it's okay, kaya ko naman, di ba? Hanggang kakayanin. So that's usually my life naman ngayon. Very busy pero very fun and fulfilling naman, yeah.
Pero yun yung dapat natututunan natin ng med
Oo
school.
nga sana nga, tinuro sana may lecture or something. Nagulat ako, oh my goodness, ganito na pala ngayon.
Yeah. So ako rin personally,
Yeah.
we also have a family clinic back in Tuguegarao.
Wow.
So my family also started the clinic around mga 25 years ago. Parang from a small clinic lang, room lang,
Yeah.
to now like a multi-specialty
Wow,
clinic.
that's so nice.
So nung
Oo.
pandemic, we didn't have anything na page or anything.
Yeah.
So I had to make one for the clinic. So ako yung gumawa ng logo. May logo na kami before. So inayos ko yung logo, inayos ko yung Facebook page and all.
Oo, ang
Tapos
galing.
ginawa ko yung page na yun. Pero sobrang hirap kasi
Grabe,
you have
yeah.
to start from scratch.
Pero buti nagawa mo by yourself nung pandemic. Kaya ngayon, ilang thousands na ba yung yung
Yeah,
likes mo and
siguro
follows?
mga 4,000
tingnan mo,
pa
at
rin.
least
Pero yung amount of people
Yeah.
na na-meet ng parents ko from day one,
Yeah.
that's not just 4,000.
Of
eh.
course,
Sure
for
ko,
sure. There are a
Marami.
lot.
So,
Different
we're trying to reach
generation.
na lahat ng nagiging patients and magiging patients ma-reach ng Facebook.
Yes. Yeah.
Kasi now, yung mga social media, parang mga patients, kapag may problem
Yeah.
sila, they message right away.
Yeah, that's
And they
very
expect
true.
you to message back right away. So, ako, nung med school, walang time actually. Nagre-reply ako sa mga
Talaga? Ay,
ganun.
grabe,
Palang.
multitask ka talaga. Ang galing.
Hindi ako nakikinig na joke.
Kasi,
So, yeah. So, nag-message ako
Oo.
ng patients kasi pet peeve ko yung hindi
Yeah,
ako
of
nare-replyan
course.
sa
Of course.
Facebook. So, yeah, now clinics and mga starting medical doctors also need to be on social
yeah,
media.
it's very important.
Need content creation para makilala sila and
I
ma-develop.
I asked my patients, of course, when I started, I want to know how they heard of me, maybe if they're referrals from my parents. At first, when I started, they would say, oh, your dad referred you to me, diba? Pero eventually, parang lately, siguro nasa 18 to 90% would say, oh, I found you online, on Google, or on Facebook. Like, really? So, parang effective pala. So, yeah, I realized they really search like derms near me, or parang they really check first feedback or reviews, kahit nga sa Reddit, TikTok, Twitter, or whatnot. Diba? Kaya sabi ko, it's really important to be socially present online already because everyone's really online. Yeah.
So, going back, since, di ba, same tayo, nag-graduate
Yeah.
in medical school and I never knew na magiging derm yung magiging specialty mo.
Yeah.
Alam ko kasi, i-continue mo yung pedia ng dad mo.
Talaga? Ayoko mag-pedia.
Akala ko eh. Ako din, ayoko mag-pedia. Pedia na yung mom ko.
Oh, talaga?
Actually. So, I love kids, but I don't like yung pediatrics as a specialty.
Yeah, of course.
It's not for me.
Yeah.
Pero, yeah. How did you decide on going to dermatology as a subspecialty?
You know, I really had a lot of considerations. When I first started med, akala ko nga I'll be a surgeon or a cardiothoracic, whatever. But eventually, I don't know, I think I found the skin very interesting, especially during my internship and the mga electives in internship, because I was actually thinking of Opta at first or Derma. But although I loved Opta, parang ako personally lang ito, baka mabasa ko. The eye was too small for me. So parang when I saw the skin and like there are a lot of lesions, very visual. So I found it very exciting. And it's not just about the aesthetics because of course when people think of dermatology, they think of skincare only or I don't know, mga botulinum toxins or procedures or lasers. But of course it also involves like dermatologic surgery, contact dermatitis, even STIs. There's a lot of fields under dermatology. And I think another big factor that helped me really want to become a dermatologist is because my own lola, she was diagnosed with BCC kasi, with multiple BCC. So parang malaking factor na na-diagnose her early by a dermatologist para ma-address yun. And of course, I said, I want to help people like how the dermatologist helped my lola. So those are one of the inspirations also for me to become a dermatologist. So, yun talaga yung main reasons why I became a dermatologist eventually.
Ay, actually, sobrang important niya. Not just for like aesthetics, but for like skin problems. Kasi I think I remember back in college nung nagmo-muay thai ako and parang someone had a certain skin disease.
Yeah.
Tapos nag-spread sa buong team namin. So,
hala.
nagkaroon ako.
Oh, no.
So, parang I had to consult with a dermatology.
Of course,
like a specialist.
Yeah.
Tapos yun, like I had treatment and all. Parang may dala kasing feeling of I have a skin problem.
Yeah, of course.
Parang
there may be stigma.
nako-conscious ka, na may stigma. Or like kapag may pimples ka, marami kang pimples and all, it affects your confidence and the way you talk to people or everything. It affects the whole person.
Yeah,
so I think it's very vital.
I mean, it's cliche when people say that the skin is not superficial or derma is not skin deep, but technically talaga, yes, it does involve the skin, but it really has a lot of facets. Psychological, even many social aspects. So you really have to address these because, sure, a lot of people argue dermatology is not life-saving, like kumbaga it's not a life or death situation. But I believe dermatology is life-changing in the sense that we really help our patients become more confident, to really help them empower themselves. So I think it's a really important thing to talk about and to also be aware of.
Siyempre kasi when you talk to someone, yung face agad
yeah,
yung,
of course.
nakikita mo. And siyempre if you have anything on the face na bothering you, it affects you, diba? So, can you go walk us through kung paano how you decided to go to the institution sa residency?
Yes. So, I train in the Philippine Dermatological Society accredited institution. So, right now, if I'm not mistaken, I think there are around 17 accredited institutions, no? This is a 3-year residency training program that is accredited by the PDS. Again, of course, we undergo an exam to really see that we have standardized knowledge. Of course, we really want to make sure that we are giving effective and safe procedures and treatments to our patients. So how did I decide? Of course, derma is one of the very competitive specialties. I know a lot of people who tried 2 times, 3 times, parang to get in, no? So every year for 2-3 years they would try until they finally get in. I was lucky because I was reviewing for the board exam, and then what happened was I was like, I want to go apply na for derma. Kasi usually people would say na take a gap year first, so at least you can study first for derma. After the boards, you can focus on fully kasi nga it's so hard to get in. Pero wala, I don't know why. I was thinking, hindi, kaya ko to. So I was of course, what I did, I checked the PDS website, yung mga okay na mga dermatology residencies and whatnot. Of course, I tried several as well, but the one that caught my attention was my institution, was the Skin and Cancer Foundation Incorporated. So, this one kasi, they have different rotations, both private and public. So, for the public rotations, we had V Luna in Diliman, QC. And then we also had Hospital Makati, in Makati, obviously. And then, we also had private rotations with consultants like Dr. Veralio Roel in VMV. We also had, for example, with Dr. Hasmin Hamora, who's currently our PDS president in Pasig. So parang sabi ko, maganda, is very holistic. It actually reminded me of Ateneo. So sabi ko, I want to apply there. And I was very fortunate nga na even if it's very competitive, nakapasok ako. So it's possible naman na you can go into derma in one try, but don't give up even if you don't get in. Kasi nga, just as long as you want it talaga, just keep going and you'll see. The next thing you know, you're a derma na pala.
What began as a small pediatric clinic has now grown into a dedicated space for healing. From one doctor to a team. From serving children, parents, and even grandparents. For 25 years, we've watched families grow, and now it's time we grow with them. At Tugigaraw Child and Adult Care Clinic, our foundation is built on values that define how we care, how we lead, and how we grow. We lead with compassion, we strive with excellence, and we embrace innovation. Our vision moving forward is to become your family's one-stop healthcare partner, a clinic built around your life. These are more than words, they are who we are, a Tugigaraw Child and Adult Care Clinic.
Hi, I'm Dr. Ellen Missy de Guzman.
I'm Mylene Medrano Kilang.
I'm Dr. Christine Campos Escalona.
Dr. Iverson S. Cruz.
And I am Dr. Minerva B. Malilin, your trusted pediatrician.
Our vision is to be a trusted family-oriented multi-specialty clinic known for quality of service, patient-oriented care across all ages. Because your health matters at every age and every season. Tugigaraw Child and Adult Care Clinic. Healthcare that grows with you.
Yeah.
So that's very nice that you shared
Yeah.
all the process of applying for dermatology. Kasi I think one of the goals of this podcast is to inspire young
Yeah, of
individuals
course.
and young doctors na who want to be specialists like for dermatology
Yes.
or orthopedics or any other business in any other industry. So you went through 3 years of rigid training
Yes.
and a lot of exams, a lot of
Of course.
a lot of consults na nakita mo. So, I think that's important sa residency na you see a lot of
Yes.
cases kasi pag nasa private practice ka na, you're all on your own, no?
What's important with derma is you really have to be familiar with all these skin diseases, especially since a lot of them look alike. So in our case, when we see a skin condition, we just don't automatically say, oh, this is the disease, that's it. We actually have to prepare like at least 5 differentials to make considerations just in case. We even have to learn about how to take biopsies and have it read just to be sure, because that's the most accurate way to diagnose if ever we really don't know what it could be. So it's important. You were also saying that this is a way to encourage people to become a dermatologist, and I think it's very appropriate. So kanina you also said that I was one of the authors of the distribution of dermatology in the Philippines. In fact, when we published that, we saw that as of 2023, there were around, if I I might forget, but it's around 1,400 dermatologists that are board certified in the entire country. It's very lacking, and of course, obviously, around 50 to 60% are in the national capital region. So we really need more dermatologists. That's why the PDS is also promoting for more applicants, for more programs. So hopefully we'll be addressing that. But again, it's really important to understand that we really want to help as much as we can, especially since the skin is really important to help with all of the conditions that it is associated with it.
Welcome to Verne Espiritu Dermatology Clinic. Led by Dr. Verne Espiritu, a board-certified skin expert, we provide safe and effective care for your skin, hair and nails. Whether you want to treat pimples, brighten your skin, or safely remove skin bumps, we create a personal care plan just for you. Visit us at Sullivan Avenue, Green Heights Newtown Subdivision, Mayamot, Antipolo City. Give your skin the care it deserves. Message our Facebook page or book your visit online today.
Yeah.
Grabe, no? So, it's really few pala
Yeah,
yung,
it's very few.
very few yung number of dermatologists in the Philippines considering how many millions na tayo in the Philippines.
Yes, exactly.
Right? So, what are the common illnesses or like common diseases na you often see in the clinics?
Oh, well, of course, acne pa din talaga. Pimples pa rin number 1. Other common diseases, of course, we also have the fungal infections, the tinea corporis, tinea manum, wherever you name it, fungal infections also, no? Others would be including contact dermatitis. Of course, when you're exposed to something, it can cause irritations. Eczemas, like numerous eczemas, are also common. We also have scabies, the infestations because of these kinds of insects, okay? We really have a lot, okay? So we have seborrheic dermatitis, different kinds of dermatitis. But of course, although these are the ones that we usually see, we're trained to also see the exotic ones, like me. And when I started my clinic, I was like hoping sana puro pimples lang. But no, I've already seen like very exotic ones, like for example, leprosy. I've already seen I'll say a random, I'm not sure people will know, but you can look it up, like Curly's disease, astrodermatosis. The point is we really have to be familiar. That's why we really study a lot in derma with all of these conditions, because in the case that one of these exotic conditions enters our clinic, we know what to do, and we know to at least what's our next step, how to manage it. Kaysa naman like, oh, what's this? Let's just try this and try that, and then baka wala mangyari. Wow, yung patient, diba? So, that's something that we have to do as dermatologists, to really see the common ones, and of course, make sure we know how to detect if there's a zebra.
Do you think there are common Filipino practices and habits that are not based on like science na you think we should stop doing? Like,
yeah, there's a lot, no? So of course I see patients when they enter my clinic, they're like, oh doc, I have this rash, ganyan. So ano po yung nangyari, ano po yung napahid na so far? And then they say, oh, they crushed the mga leaves ng bayabas or whatever leaves, pinapakuluan, and then they put it there. Or yung para mga, minsan they even have yung mga amoxicillin na mga tablets, and then they would crush it and then also apply it there. And then I would ask him, so ano pa yung nangyari pagkatapos? So, nag-infect, ganyan. So, I think those are one of the, actually, that's very common. Kakatawa, pero I was like, nakakalungkot din na until now, may mga ganong notion na that helps. Because for one, we're not sure how sterile those preparations are. And two, there's, again, no scientific basis. So, if you expose your skin to those kinds of crushed leaves or crushed, pills, it can really cause some complications or even cause the infection to worsen. So, of course, we would advise to don't try to apply random things on your skin, but instead consult first so we can know that if it's safe to apply and effective to apply to solve your concern, no? So that's one of the common things that I see. What other things I see? Of course, there's a lot of skincare trends on Facebook, on TikTok, no? Yung try this, the Rejuve, try that, try this. Do the 10-step skincare routine, mga parang Korean, ganyan, uso-uso. Ang daming uso. The thing is, in theory, I believe naman these products want to give the best for people, no? Syempre, kaya nga na market. But of course, we live in the Philippines. It's a tropical country. Medyo mainit. We also have, it's more humid here. So, of course, sometimes these products can be more irritating. It can be actually more harmful. Sometimes these sets that are supposed to brighten your skin might eventually cause your skin to darken or cause complications. And that's why we don't want to try these or parang just try too many products. We usually review your products, the ingredients, and then we see if it's okay or safe for your skin, and then we give advice. So, just be careful with trying all of the TikTok trends, porket nasabi try and test it. Kasi again, it might not be the best option for your skin. It might cause more side effects or complications. So better before you start anything, if you're not sure, ask a dermatologist, a board-certified dermatologist, and we'll really help you and we'll guide you through the process.
what began as a small pediatric clinic has now grown into a dedicated space for healing. From one doctor to a team. From serving children, parents, and even grandparents. For 25 years, we've watched families grow, and now it's time we grow with them. At Tugigaraw Child and Adult Care Clinic, our foundation is built on values that define how we care, how we lead, and how we grow. We lead with compassion, we strive with excellence, and we embrace innovation. Our vision moving forward is to become your family's one-stop healthcare partner, a clinic built around your life. These are more than words, they are who we are. At Tugigaraw Child and Adult Care Clinic.
Hi, I'm Dr. Ellen P. de Guzman.
I'm Mylene Medrano Kilang.
I'm Dr. Christine Campos Escalona.
Dr. Iverson S. Cruz.
And I am Dr. Minerva B. Malilin, your trusted pediatrician.
Our vision is to be a trusted, family-oriented, multi-specialty clinic known for quality of service, patient-oriented care across all ages. Because your health matters at every age and every season. Tugigaraw Child and Adult Care Clinic. Healthcare that grows with you.
So
If I see a product sa TikTok, for example, yung may soap or something,
yeah.
What do I look for, like, na sign na it's a legit product or what?
Well, yun yung mahirap. Kasi there's a lot of, I would have to say, you have to check the ingredients. But again, it might be difficult to see the best ingredients for you. When my patients go to my clinic, they ask, is this product okay? The very first thing I tell them is, what are the ingredients? May I see the ingredients so I can give an advice if it's okay or should we tweak it? So, yes, it's okay to go on TikTok. Maybe what of course, number one for medication is it FDA approved? Is it safe?
FDA,
Is it
yes.
is it legit in the sense that it's approved by FDA? Because there are a lot of counterfeits. You'll be surprised. You might even see some people, they're injecting some injectables to themselves on TikTok and saying it's safe, but it's kind of scary kasi for one, why would you inject yourself? Diba? Medyo, kahit ako, ayaw ko nga gawin yun eh. Pero, lalo na kung hindi yun FDA approved, nakakatakot. So, yun, at least maybe bare minimum, check if it's FDA approved. And then, of course, I would say check the ingredients. But again, if you're not familiar, just consult your dermatologist first. At least, yun yung baseline to see if it's okay for you. Okay?
Actually, yung dami kasing products ngayon.
Yeah,
Especially in
oo.
TikTok kasi it's way cheaper than the usual.
Yes.
And napakadaling mag-add to cart. So, lahat ng tao. And then yung promotions din nila, it's very, syempre gagamit sila ng model na maganda or guwapo.
Of course.
And then lalagay nila yung product there. And mapapa-add to cart yung a lot of people and kulang sa information about it. And so now, at least we know that FDA approved dapat.
That's at least the baseline that you should check if it's FDA approved.
Yeah,
No?
and you should always consult your board-certified dermatologist. So, you mentioned earlier na there are common practices na Filipinos do. As a guy, as my viewers, I think, are mostly
Of course,
men, but like more general na, what are common grooming tips or like what are essentials that you think we should have?
As men, I have a lot of male patients, no? I've noticed, maraming tamad mag-apply ng skincare. I mean, to be fair, ako naman din
Ako
dati,
din
di ba? I mean, acceptable. Pero, ganito yun. For me, may point naman kasi syempre, men are more busy, minsan oily, or parang they don't have the time. But, you have to understand, of course, just because you're man, it doesn't mean that you shouldn't take care of your skin, no? I actually have a study about male skincare as well, no? Interestingly, lately, younger generations are also starting to realize it's important na kasi dati may stigma na parang hindi nakakalalaki if you do skincare, but now they realize it's important. So I think as early as a teenager, you should really know how to do proper skincare. It doesn't have to be yung mga multi-step, no? Ako nga, when I prescribe to my patient, it's usually 2-3 steps lang in the morning, something like that in the evening. So at least, no? So for men, I would say the pinaka-basic skincare would be a gentle cleanser. And then afterwards, in the morning, kung ayaw mo talaga mag-apply ng kahit sunscreen. If there's anything you have to apply, sunscreen is the most important. Usually, people ask me, what kind of sunscreen? What brands would you recommend? Ako, I don't have a recommended brand. Ako basta SPF 50 pataas, that would be actually okay to protect your skin already from majority of the UV rays, no? But the thing is, the question is, which is the best brand? It really depends if you will apply it. Kasi nga, what happens is, some people, they do have a nice brand, pero when they apply it, they don't like the feeling, so tinatamad sila. Technically, for sunscreen kasi, when we apply it, 30 minutes before sun exposure, you have to apply 2 finger breaths. So, this is like 1, 2, entire face. If you can put sa neck, even sa ears, ganyan. If you're outside, every 2 hours, mag-re-apply ka pa ng sunscreen ideally. Bakit ka kailangan mag-re-apply? If you're outside, syempre, you're more exposed to the sun. And then, syempre, if you have sweat, syempre, it will, cause the sweat to fall down. Of course, it will also bring down the sunscreen. So, you need to re-apply talaga. So, if you're tamad, if you don't want to use your sunscreen kasi baka mahapde or baka it's too sticky, sayang, wala ding point. So, that's something that people, especially men, have to realize. Do you really need sunscreen? Yes, syempre talaga. Kasi even though we're Filipinos, usually, diba, nakikita mga skin cancer more for the mga foreigners, yung mga lighter skin types. Filipinos are still prone as long as you have sun exposure. You might not notice it now when you're young, but eventually that will accumulate, no? And it's not just mga skin cancers, even the mga benign lesions, not sometimes, or mga dermatosis papulosa nigra, those are mga dead skin that then can't be exfoliated because of sun damage. Parang that sometimes happens. So, to prevent all of those, the mga hassle na yun, might as well protect your skin as early as now. So, yun. If you're asking also, how about the night? Ako, usually, cleanser. I could prescribe usually a medication to help clear the skin or make it more okay with the texture, with the different discolorations. But if ayaw din talaga ng lalaki, edi kahit moisturizer na lang to protect and restore and repair the skin at night. So, it's very basic. Basta importante, may skincare talaga.
Okay.
Yeah.
So, at least parang 3 yung sinabi mo.
Mga 2 or 3.
Cleanser, sunscreen, and a
Yes.
moisturizer.
Yes, that's
So at
actually
least
the 3. That's okay na.
morning and night.
Yes,
Okay.
ideally.
So I think that helps a lot kasi
Yeah.
well, ako kasi personally, it's my wife
Oo,
who's very rigid sa
Tama, oo
kanyang
naman.
skincare.
Yeah.
And minsan sinasabayan ko, minsan
Ay.
tinatamad na ako kasi
Well,
nagmamadali ako
of
in the
course,
morning.
understandable naman.
And sometimes na may feel ko pag meron akong ina-apply, mas lalo siyang dumadami.
Ayun lang. So,
Ako hindi ko alam kung is it just the product that I'm applying or is it because the idea na I'm applying it parang mas na-irritate ko yung face ko. Does that happen?
it does happen. So again, although I said, diba, I don't have a specific brand, we still have to check because, for example, if my patient tells me, Doc, I feel like my face feels tight or I'm flaking, there might be some ingredients in the product that might cause that irritation. So we might have to change the product, no? So again, it's still best to check your board certified dermatologist. But usually for that naman, no, it's really a try and testing as long as you have a certain ingredient that's active there, and then we'll try it, and then if it's okay, that's good. If it's not, if you feel like there's more pimples, it may be one, the product is too irritating for you, or two, maybe there might be a lacking step. Maybe we have to add a medication or something to further improve the effects on your skin.
Welcome to Hermoso Espiritu Dermatology Clinic. Led by Dr. Verne Espiritu, a board-certified skin expert, we provide safe and effective care for your skin, hair, and nails. Whether you want to treat pimples, brighten your skin, or safely remove skin bumps, we create a personal care plan just for you. Visit us at Sullivan Avenue, Green Heights Newtown Subdivision, Miamot, Antipolo City. Give your skin the care it deserves. Message our Facebook page or book your visit online today.
So, yun pala siya.
Yeah.
So, actually, it's very basic but complicated at the same time. No?
Yeah, of
it's
course.
just a habit of doing it every single day para maging maganda yung skin mo. No?
Yes, of course.
So, apart from that, parang na-realize ko when I was doing sports back in college, I was always under the sun. So, nagbabike ako, nag-running ako, and ano pa ba, nagmomotor ako. And laging may exposure sa sun.
Ayun
And
lang.
then, siguro for a significant amount of time, parang may sun exposure. Nag-apply naman ng sunscreen. But I think recently, mga people then is maraming sports na, na under the sun tennis.
Of course.
Minsan, pickleball under the sun.
Usong-uso yun ngayon.
Running. Yeah,
Yeah,
especially
right.
running.
Oo,
So,
running,
apart from like sunscreen, do you have any other advice to people like them?
Well, of course, sunscreen is still the best way to really take care of your skin if you're very active under the sun, no? Some people say, can it be another form of sunscreen because they might feel like it's hard to apply a lotion every 2 hours. Technically, lotion is still the best primary application, the lotions or creams. But for example, you really have a hard time to reapply, you can try a sun stick, even a spray that can also help. So it really depends. Again, what's important is it's better to apply than apply nothing at all. What if you really don't want to wear sunscreen? Well, bahala ka. Pero hindi. What I would say is, of course, there are other protective clothing. For example, a rash guard, a hat, if you can, wear a cap or like a shawl. Just protect your face, your skin. That would help a lot, okay? So, those are the things we can do. But again, at the end of the day, sunscreen pa rin yung number 1 most recommended.
Kasi too much exposure in the sun can...
I mean, it can cause sun damage, of course, no? And because of that, eventually, it can cause sunspots. That's benign pa nga, sunspots, no? It can cause mga sun damage, some... skin will be having some changes that will cause it to be having a difficult time to exfoliate, kaya nagkakaroon ng mga dermatosis papilosa nigra or the quote-unquote warts that are not viral, ha. And then yung pinaka-severe na nga would be skin cancers, like gano'n, no?
Too much exposure sa sun. Yeah, so kasi a lot of people din, mga work nila is under the sun So like hindi nila maiiwasan siguro mga enforcers, policemen, and mga traffic people and all. What began as a small pediatric clinic has now grown into a dedicated space for healing. From one doctor to a team. From serving children, parents, and even grandparents. For 25 years, we've watched families grow and now it's time we grow with them. At Tugigaraw Child and Adult Care Clinic, our foundation is built on values that define how we care, how we lead, and how we grow. We lead with compassion, we strive with excellence, and we embrace innovation. Our vision moving forward is to become your family's one-stop healthcare partner, a clinic built around your life. These are more than words, they are who we are. At Tugigaraw Child and Adult Care Clinic.
Hi, I'm Dr. Ellen P. de Guzman.
I'm Mylene Medrano Kilang.
I'm Dr. Christine Campos Espalonia.
Dr. Iverson S. Cruz.
And I am Dr. Minerva B. Malilin, your trusted pediatrician.
Our vision is to be a trusted family-oriented, multi-specialty clinic known for quality of service, patient-oriented care across all ages. Because your health matters at every age and every season. Tugigaraw Child and Adult Care Clinic. Healthcare that grows with you.
So, another thing na siguro pinaka-important na topic among adolescents and people in general, siguro yung acne.
Yes, of
so,
course.
acne, what can you say about having acne? How do we manage it as a...
So, this is the favorite topic of all dermatologists. All na talaga nag-generalize But yeah, acne is of course the number one most common concern that why people go to dermatologists. No? So, of course, it starts usually for teenagers, sometimes even early teens, even as early as 8, 9 years old. No? So, there are a lot of factors for acne. Acne is caused by one, of course, genetics play a role, no? So we usually ask if their family members have had acne. Lifestyle plays a role. What they eat, what they do, how often they sleep, how many hours of sleep they get, even what they apply, no, on their face, the makeup, the mga hair products, they all play a role in acne. So this is a very important thing. Of course, people wanna say, what's the way to cure my acne? Kaya naman, pero it will take a long time. Siguro, some people think kasi once they see a derma, after applying once, tapos na. Pero ako, I really tell my patients, it is a process because there are factors that will really contribute to acne, wherein, for example, there's a problem with the exfoliation of the skin causing clogged pores. With the clogged pores, there will also be some more excess sebum that don't get out. And then that's also food for mga bacteria, ganun, eventually causing mga pimples and also leading to mga inflammation or pagmamaga, no? So those things we usually address with medications. But again, it doesn't work overnight. I usually say it takes sometimes may mga purging pa experience, no? Yung parang dumadami pa yung pimples temporarily. Minsan mga 1 to 2 months, ganyan. Ako, I had it for mga 3 to 4 months pa nga eh. But siguro by 4, 5, 6 months, mas they will see more improvement. So my point is, it depends on each person. May mga people naman, as early as 1 month, naggaganda yung skin kaagad. Pero may mga iba talaga, nag-worsen temporarily. Or iba, it takes time. So, it's a process. So, they really have to just trust it or communicate well with their dermatologist if they have any concerns or they feel like the process is slow. But eventually, as long as they continue and they really consult and have follow-ups, we are able to address their acne and make them happier. So, ayun, no?
How about sleep and nutrition? How does it affect
it's a big...
acne?
Of course, with the difference of sleep and nutrition, that also causes mga changes in our body, no? If you are not able to sleep properly, of course, how will your body repair itself? And acne is very correlated to hormonal changes. So of course, if the sleep cycle changes, the body will also have difficulty adjusting. That's why actually a lot of my patients who especially have night shifts, they note that their acne increases because yun na nga, naninibago yung body niya. At the same time, I always ask my patients, do you like milk tea? Do you like mga sweets, fried foods, mga oily foods, junk foods, syempre. Ako guilty ako, pero syempre in moderation, diba? Pero the thing is, again, they can cause more inflammation. We have studies that also show that if you take an inflammatory diet, this is also correlated to increase of pimples. That is why when we see our patients, we really advise them anti-inflammatory diets, especially if you're really having a breakout. Because we have some patients kasi na parang, naka 1 to 2 months na siya ng treatment. Pero sabi nila, Doc, walang nangyayari at all. I think even if nag-purge ko, walang nangyayari. Tapos I will ask, did you sleep enough ba? Or what are you eating? Doon ko nalalaman pala na hindi pala sila inayos ng lifestyle nila. So, even if you do all of these recommendations for the medications, even if you do all these procedures, pero if you don't fix your lifestyle, baka you won't get the results that you want talaga, no? So, it all plays hand in hand in really improving the skin.
So, all-encompassing pala siya.
Yes, of course. Kailangan yan i-address lahat. Kaya talaga matagal yung mga derma na mga acne consults ko. Para mag-gets nila.
Yeah, kasi ako rin for residents like me,
yes, of course.
lagi kaming puyat.
Oo.
We don't eat the best food.
Oo, same.
So, we find a hard time na
Yes.
Especially na we don't have that much time na mag-skincare man lang sa umaga or gabi kasi we're rushing or puyat na kami and also at least you gave us advice kung paano kami makaka-improve and for all our viewers also.
Yes, of course.
So siguro one of the common problems rin in young to adult na mga men is hair loss. Siguro,
yes.
Siguro baldness, hair loss, and etc. Do you have any advice to other people who are having hair loss issues?
Hair loss is again one of the very common issues. No, so I forgot to mention pala. So board certified dermatologists were trained to assess the skin, hair, and nails. No, so tatlo yun. No, okay. Sometimes people don't remember na pala. Mga pala sa buhok din pala kayo sa kuko. So yeah, just putting it out there. So for hair loss, no, we call that the diagnosis to be androgenetic alopecia. No, for males. No, this involves again genetics because of the of course we have more testosterone. This is converted to DHT or dihydrotestosterone. Sorry, nabulol. And then that would also sometimes stimulate eventual hair thinning or the hair follicles becoming smaller, and then yun na mapaperceive na hair loss. So how do we prevent this? So technically it's a genetic thing, so it really will happen at some point for a lot of males, but what the most we can do is, of course, we can slow it down or even try to in a way lessen the visible hair thinning. So there's a lot of ways. Of course, we don't do aggressive kagad na hair transplant kaagad. Usually mga last resort na po yun. What we do is, of course, we can try topical medications first, oral medications. Of course, all of these have their pros and cons, and then we have to tell the possible side effects just so that our patients are aware, no? But a lot of them naman are willing to take it. Personally, I tell the side effects just to disclose, pero a lot of my patients naman, they don't really experience these naman or minimal naman, and they're more happy with the results, no? Of course, there are other treatments. We can do mga sa pag-stimulate ng hair blood flow, no, to protect the hair or even stimulate the hair growth. There are a lot of things ngayon. There are a lot of advanced for hair loss thinning procedures,
minoxidil,
no? Yeah, minoxidil yun yung sabi ko yung topicals eh. Pero yung iba, may mga microneedling, may mga exosomes, PRPs, madami na eh. I can go on and on about that.
Yung microneedling, I think that's I saw about.
Yeah, they parang make micro channels, no, yung mga wounding channels, so that you can also promote. One, it helps to stimulate the blood flow to the scalp, and two, that can be a channel so that you can insert, for example, the topicals even more for better absorption, or even like the serums or mga exosomes or mga small molecules to further promote hair growth. So there's a lot of things we can do for androgenetic alopecia naman, no? So it just is a matter of starting and acknowledging na you need help, no? So yun naman. Other things, technically, some people, they also experience stress, no? And eventually, they might say, oh, doc, I don't have hair thinning before, but out of doors, sobrang dumadami yung hair fall ko, ganyan, no? There's something called telogen effluvium as well. So, hindi naman. I don't think that's yours. Parang yung nangyayari sa telogen effluvium, again, because of the stress and whatnot, it affects the hormones, also stimulating and increasing the growth cycle to cause the hair to fall, no? Although, technically, I tell my patients, how many strands of hair ba yung nahuhulugan ka? If they say it, diba? Technically, kapag mga 50 to 100 a day, that's actually normal. Pero technically nga, syempre, mga people, they get worried, baka may underlying thing or baka may pinagdadaanan. Sige, I explain naman and reassure them. But again, for those instances, sometimes for the telogen effluvium, we wait it out na lang until after hindi na siya ma-stress, babalik na yung dating hair cycle. Again, we can give mga topicals again just to alleviate it. Or aside from that, we can also check na lang just in case kasi it's possible naman. I keep saying baka stress, baka hindi pala. So this is something important din as a dermatologist. We have to still investigate and rule out other underlying diseases kasi it's true naman eh. Sometimes hair fall can be caused by for example, an underlying malignancy. Sometimes it can happen, or an infection. That's why I also sometimes request for lab requests just to see and rule out all of these things, just so we don't miss anything. So, in short naman, there are a lot of treatments for hair thinning. Again, there are different kinds of reasons, but in the end, we can treat them appropriately. What's important is you have to consult before it becomes worse or before it's too late. Wow, too late.
Kinalbo niya na.
Yun nga eh. Huwag naman. Hindi naman siguro.
So ako, nagsisave up na ako for hair transplant anytime soon.
Grabe na ba? Huwag na muna. Hindi ka, nag-topicals ka na ba?
Hindi, wala pa naman.
Yun
But
naman
kasi
pala eh.
mother side, yung balding namin is in the front. Father side, balding namin is at the back. So,
Hindi
yung joke namin is, now pa lang, you're saving up for hair
Grabe
transplant.
naman. Pwede naman yun, I know a lot of people as early as 30s and 40s. Tama naman. They're saying, Doc, I'm worried na na my mother's side, kalbo na sila. My father's side, kalbo na sila, ganyan. Tapos sabihin ng mga, usually kami sabihin, okay, we can start this as early as now para at least, diba, we can prevent it. And then eventually, like I have consultants, they would say daw na minsan their patients would come back and say, did you know, Doc, pumunta ako sa kanilang family reunion namin or sa mga reunion with their classmates, yung mga kaklase daw nila, mga kalbo na daw. Pero siya daw, since na early, nag-umpisa, okay ba na yung buhok niya? So, the point is, kaya naman talaga, no?
Yeah.
It's hard. Syempre, it takes time kasi nga, again, this is not a one-time thing. Usually, we see full effects to see if it's okay yung mga procedures in 3 to 6 months. Kasi nga, the hair cycle takes time to grow. But again, after that naman, usually naman, we see improvement. Or if not, we can try other options, no?
Actually, I have a relative who had hair transplant.
Yeah.
And I really saw yung effect on him,
yes.
on how he looks and his personality na parang talagang in their age group, parang siya yung isa sa mga may
diba? Nakakatuwa.
So, nakakatuwa naman.
Yeah.
And I think some of my relatives are also considering it.
Yeah.
So, it's good that we talked about it kasi a lot of people are also curious about
Yes, of course.
yung mga treatment sa hair. Kasi it's kind of bothering din if you're seeing na you have a receding hairline, medyo tumataas na, numinipis na. Parang it's one of the concerns kasi apart from your hair, your face and all, andun siya eh. So, when you were young, kaya mo siyang ayusin, kaya mo mag-wax, kaya mo mag-style, tapos biglang parang nag-thinning na. So, I think it's a topic na hindi mo masyado pinag-uusapan with anyone but like your doctor lang. So, medyo sensitive topics din sila if you think about it.
Actually, napapansin ko lately, mas madami nang papakonsult about hair loss. So, it's very appropriate to talk about it na it's okay to acknowledge it. Kasi iba, syempre, nagka-cap na lang, tinatago. Pero eventually, mas dumadami, nagpapanik na sila. So, at least as early as when you notice it, consult ka na para at least we have options. Kasi it's harder to start if it's really, medyo nag-lessen na. Kasi kaya pa yan kung nagsa-start pa lang eh. It's easier and less complicated, no? So, that's something important to take
note. Tsaka may graft site ka pa.
Siguro,
diba? If you're talking
mahal
about
din yung hair transplant,
Yeah, I think parang 300 or more.
Something like that.
Or you have to travel somewhere else.
Welcome to Hermoso Espiritu Dermatology Clinic. Led by Dr. Verne Espiritu, a board-certified skin expert, we provide safe and effective care for your skin, hair and nails. Whether you want to treat pimples, brighten your skin, or safely remove skin bumps, we create a personal care plan just for you. Visit us at Sullivan Avenue, Green Heights Newtown Subdivision, Miamot, Antipolo City. Give your skin the care it deserves. Message our Facebook page or book your visit online today.
So, okay, we've tackled about acne.
Yeah.
We've tackled about men's grooming and also about hair loss. Siguro isa pa na mga common, when I was an IM resident, I've been seeing a lot of patients having skin allergies.
Yeah.
So, isa din yun sa mga most common na topics namin or even mga consult is allergies. And syempre, alam ko siya i-treat as an IM or as a general physician, but as a dermatologist, how do you treat or how do you advise patients or like viewers about skin allergies?
So this is a very common topic as well, no? So thank you for bringing that up, no? So skin allergies, actually kasi usually what we focus on would be what goes in contact with your skin. Kaya actually yung term namin more of contact dermatitis, no? Kasi nga, for example, we have a patient and then we, for example, see that they have red plaques or erythematous plaques here, no? Naging medical term, sorry. Tapos, they're asking, ano kayo nangyari? What did I do? And syempre, you have to prove. Kaya medyo makulit kami mga derma. We have to know like, what did you hold? Ano yung mga sinusuot mo? Do you have new jewelry? Ganyan. And for example, I find out gloves pala. Kaya detergent yung ganyan. So,
bedsheet.
some people, I think, isa sa mga pinaka-common lang questions sinasabi sa akin, Doc, dahil ba ito sa pagkain? Kasi sabi nila, parang nangangati kapag may kinain akong malansa, ganyan. Number 1 yung tinatanong sa akin. Pero ako kasi, sasabihin ko, every time ba ikaw uminom or kumain ng certain na food na yan, nagkakaroon ka ba ng allergy? Kasi kung ganun, possible. We can work up with an immunologist, allergologist rather. But if not, baka hindi siya dahil sa pagkain per se. Or baka nga, something's in contact with your skin, no? So as much as possible, we exhaust first everything that the patient is in contact with. For example, like clothing, detergent, soaps, even mga sprays, anything in contact with the skin. And then, of course, we have to check the mga lesions. Where is it affected? Would you believe sometimes they have contact dermatitis here? So when we probe it pala, yung dahilan ay dahil sa nail polish. Kasi nga, they hold their eyelids, ganyan, and yung eye is very sensitive. And nalalaman namin pala, for example, naka-gel sila or something. Doon pala kaya nag-trigger yung skin allergy or contact dermatitis. So, it's something we really exhaust. For example, there are cases, however, now, we don't know ano yung cause ng skin allergy niya or mga contact dermatitis. We offer a patch test. So, a patch test is, we use multiple reagents. Kumbaga, we have different kinds of chemicals, no, na products. We place it on their back, controlled amounts, and then we will see what exactly are they allergic to, no? That's how we can diagnose allergic contact dermatitis talaga. And from there, we are able to advise them, you have to avoid these na pala or avoid these kinds of products. So, it's very complicated and exhaustive. Pero yun na nga, it's important to understand din so that at least they know what to avoid or parang they won't ban themselves from eating certain kinds of food kahit hindi man kailangan. But again nga, sometimes pwede naman talaga sa pagkain, we advise them naman. Yun na nga, try to check it for an allergologist, pwede mga skin prick test, ganyan. Ibang mga process naman din yun. So we will also work hand in hand with the mga allergologists in these kinds of matters, no? So yun.
Kasi I think a lot of patients self-medicate with antihistamines.
Yeah, oo.
So, pag nagkaka-flare na, or before sila kakain ng crabs, iinom sila, and then magkakakati-kati, and then ulit-ulit lang. It's a cycle.
Yeah.
And then I think isa pang common na factor causing mga allergies, mga skin asthma and all is also stress, diba? May mga some cases ako before as a general physician na nagtatanong sa akin na bakit lumalabas siya usually kapag medical season, board season, kapag stress. Does that happen?
Yeah,
is it psychological din? Pwede?
I think there's also a psychological play with that because actually, for example, skin asthma is associated. Usually, I would ask them if they have a history of atopy or parang did they have bronchial asthma, do they have allergic rhinitis, runny nose in the morning, no? So, eventually, although a lot of people, lumalabas ito, yung atopic dermatitis as a child and usually they outgrow it by their teenage years, a lot of people still have it even as an adult. So, it's true. What happens here kasi is there is a genetic defect that is happening in your skin. In simpler terms, nagiging mas sensitive yung skin nila. That's why they're more prone to dryness, to eczemas, etc., etc. And it's true that, for example, maybe if malapit yung boards or malapit yung mga stressful events, it can flare because one, pwedeng the skin might be more dry or more sensitive, baka hindi sila nakaligo or baka scratch sila. We don't know, may mga reactions na ganun, no? So it can really trigger. We also don't know sometimes what they apply on their skin, mga soaps, mga perfumes, it's all the more causing the flare. So yes, it's possible that stress can exacerbate this, especially if you're in an environment na medyo mainit or malamig. It really depends on the body, no? I can't give them a one-time example na basta it happens for everyone, no? It's how your body reacts to certain situations. So, it can happen, flares can happen, but again, it's important to treat it and again, to consult how to appropriately manage these, no?
So a lot of the diseases of the skin involves a full encompassing lifestyle change involving sleep,
Definitely.
nutrition, stress management, habits, daily morning routines, morning habits mo such as yung mga cleanser, moisturizer, sunscreen, and all. So, it's good that we talk about that kasi at least now we're more educated sa kung anong gagawin.
Yeah.
And then, to recap also that we don't just buy any product and then we don't just buy any product, apply it to our skin, and then afterwards, pupunta tayo sa dermatologist kapag may problema na.
Kaya nga,
diba?
wag na muna
So,
ganun.
wag naman ganun.
Oh.
So, this is the reason why I invited you here kasi personally, I also experienced that a lot of times.
Yes.
I've also consulted a board-certified dermatologist a lot of times.
Yes.
Pupunta ako sa isang certain clinic in Mega Mall and all. And then, kasama ko pa yung mom ko. I vividly remember when I was a kid, high school ako, adolescent age, syempre conscious ka, nagkaka-pimples ka. Lagi kami nagko-consult with a dermatologist. Siguro more than a lot of times. Nagpapa-skincare kayo, nagpapatanggal kayo sa face and all. So, dermatology is a very a specialty that's very important talaga for everyone.
Yes.
So, siguro let's try to move on to the more viral topics lately.
Yes.
So, as a dermatologist, pag nakikita mo sa feed mo, what are the mga products or anything that you think parang oy, mali to parang it's not appropriate or anything.
Wala, ito na yung mga
yung
topics.
sa'yo lang na you think is worth mentioning.
Of course, I think the number one part, alam mo, honestly, is a timeless topic, but it still keeps coming up. IV drips, no? Yung mga intravenous drips, no? So, technically, madami ng mga statements na submit yung PDS online. Alam ko nabalita na to, pero it's still very trendy, it's still very popular, no? Yung mga, I don't know, yung mga glutathione drips that they insert, diba? Tapos, pampaputi daw, ganyan, no? So, until now, no, we still have a very strong stand against IV drips because, again, these are not FDA approved. So, that's one. So, we're not sure about how safe they can be talaga. Second, it's also not really proven in clinical studies. Kumbaga, there are no official studies really saying na, you'll become whiter because of an IV drip, no? And it's really scary kasi nga, people might think na you can do it commonly, but again, this can cause systemic damage, for example, sa liver, no? Because nga, it goes directly to your bloodstream, wala ng filtration or whatnot. We also have patients before who had experienced anaphylaxis kasi hindi pala sila okay or allergic pala sa gamot. So, there are many complications. People say, everyone become whiter. Sabihin ko naman, love your skin type. Ewan ko, parang yun lang yung kailangan ma-realize. If you want to, we can try mga lightening creams, pero to risk your skin and undergo these kinds of drips, it's kind of scary. Some people ask, fine, how about supplements like mga collagen or glutathione supplements, no? Technically, I will have to still admit na I don't really prefer this because again, technically, glutathione is not really for skin whitening. It's really a chemo drug, no? Mga for mga toxic whatnots. Isa sa side effect lang na minsan pumuputi daw yung balat, no? Collagen naman, okay, maganda yung collagen, our body needs it. Pero again, not necessarily if you take it, it will go to the skin. Kasi nga, our bones need collagen, ganyan, mga tissues need collagen. So, hindi man guaranteed it will go to the skin. But again, I tell to people, compared to IV drips, I would say these are, a bit safer. Pero I think naman there are some products na FDA approved. Sige, like, I'll give you that. So, if you want to try it, go. Pero make sure na lang na yun ang FDA approved and maybe tingnan muna natin pero avoid na yung long term kasi nga, again, it can cause naman complications pala kung you keep taking it. Baka na pala, you don't know, baka your kidney or liver, something is already being affected. No? So, I guess, these things are very trendy, but again, just because they're trendy doesn't mean they're safe or they should be done. So just be careful talaga with these kinds of trends, no?
Yeah, and it's not cheap, Like all the services are not cheap. So I think kapag ganon, be wary muna.
Yeah.
Like, make sure to get advice from a board certified. Like, I stress on board certified because these people trained their ass off. As in,
Grabe talaga.
nag-aral sila.
No joke.
Marami exam, marami na silang nakitang patients, and they're trained enough to treat you and to know well.
Yes.
So, well, of course, if you check online, marami ka makikitang things, but it has to be fact-checked.
Yeah.
There should be research. And not just research. Dapat yung research na yun ay well-conducted research.
Yes,
diba?
of course.
So, it's not just anyone can post a research naman. Diba? So, a lot of the things online can harm you. So, you have to really check. Diba?
Yes.
So, I was curious lang kanina na mention mo about skincare, whitening and also loving your skin.
Yeah.
So, growing up, I came from the hottest place in the Philippines.
Oo nga pala, grabe.
Tugigaraw.
Oh, yes,
You can go until 40 degrees and
grabe,
all.
Hindi ko kaya.
And of course, dahil madalas kami naglalakad sa labas, mainit yung sa place. So, a lot of people are, let's say, dark-skinned.
Yes.
So, if a patient comes to you, dark-skinned, wanting to get whiter ng konti, how do you talk to them? What's your advice to people?
I think this also has to involve some psychological counseling. You have to understand, why do you want lighter skin, no? What exactly? Because actually, technically, if you have darker skin, you have more melanin, no, pigment. So technically, you're safer from getting skin cancers. Actually, that's actually a good thing. So if they ask me about lightening, I really ask why. What are our goals? So ako naman, I just don't say na, you want to lighten? Sige, let's do it na. That's why it's important. You also have to ask, like, what exactly do you want to achieve from this? What are your expectations ba? Because I cannot guarantee na, for example, from very dark skin, magiging sobrang bright mo bigla na, diba? Parang hindi naman yun realistic. As much as possible, of course, I explain to them, number one, what's important is your skin is healthy, wala siyang mga rashes, wala siyang lesions, no? It's clear, it's not dry. Lightening, we can try, for example, some peels or whatnot. Maybe yung lightening na it's acceptable for me, for example, nagkasugat before, and then nagkaroon ng quote-unquote peklat or yung post-inflammatory hyperpigmentation, yun naman talaga, we want to lighten kasi nga, yun yung residue ng previous na mga skin rash. But if it's like changing skin tone, I think that's something that you really have to educate your patient na, one, it's not really recommended, and two, you really have to understand where they're coming from. Kaysa, you don't want them to lighten your skin, pero there might be other side effects na hindi naman maganda. Like I said, the lighter the skin din, the higher the risk din for mga skin cancers, diba? So, I am really an advocate of loving your own skin. We're gonna make it the best it can be, but ayokong i-alter to the point na we don't, parang nag-iba na yung race or something. I don't know.
Yeah. So, ako kasi growing up, yung mom ko was like giving me mga sunblock whitening things. Kasi nga medyo may itim ako. So, before gusto niya ako pumuti. So, siguro at least now, they know na you're healthier pala if you have like more
actually. Very yun. Important
very healthy.
To know.
So, misconception din yun, diba? Yeah, so to cap off, siguro our episode on derma, anything you would want to advise to the younger generation who wants to take up derma also, and to your younger self if you were to go back?
Siguro, for my younger self, kasi ako dati, I really love skincare na. Pero hindi ako nagpapaderma kasi I had this misconception na mahal magpaderma.
Yeah.
I would try a lot of things, parang dahil ko mga procedures na trinay, yung mga facial, pero bumabalik yung pimples ko. Eventually lang nga, when I was finally a resident, doon na nag-clear yung skin ko sa mga pimple problems ko. So, for my younger self, I would say, and even for younger watchers, don't be shy to check a derma. Maybe it might be expensive, pero one consult can go a long way, no? Instead of trying so many different products, eventually it might complicate your skin and it might cause more problems. At least start pa lang, you know what to do now with your derma. So it's a big investment that will help you throughout your life, no? For those who want to be a dermatologist naman, Again, referring to my old self, I was actually afraid when I entered because everyone would say, oh, to be a derma, dapat magaling ka. Dapat stellar yung grades mo, ganyan. To be clear, I'm average in med school. As in, average talaga ako. So, parang sabi ko,
Hindi totoo yan.
oh, hindi. Totoo talaga yun. Basta, the point is, don't give up. Try mo lang. Kasi you never know kung para sa'yo. I know people nga, like I said, diba kanina, people who try 2 times, 3 times, they really didn't give up. Kahit some people are saying, maybe you should move on, maybe find another specialty. But if you really want it, I think you should really try and fight for your dreams. Kasi nga, like I said, those people who I know na 2 or 3 times, ngayon, derma na sila. No regrets, diba? So, just keep trying. Of course, there are ways to prepare. Syempre, mga aral-aral is part of that. But in the end, you have to know your why you're doing this, and just keep going. And eventually, baka naman, diba, makapasok ka. Even if they all say na you need this, you need that, baka hindi makakapasok or whatnot. Despite all of those, just keep going. And I am going to cheer for you guys. Yes.
How about for those na mga doctors who don't want to pursue residency or are parang nagdadalawang isip sa pag-residency? Do you think it's worth it now that you're a diplomate?
I mean, syempre, masaya na ako na diplomate ako. Ulitin ko ba? Hindi. Ayaw ulitin nga. Pero, what can I say? I get the point naman of a lot of doctors ngayon, di ba? Hot topic yun na parang residency is very toxic, ganyan. I mean, it's true. Kahit sa derma may ganyan. I'm not gonna sugarcoat it. It's mahirap. But if you can find an environment that is best suitable for you, kasi mafe-feel mo naman din yan sa pre-res, if okay yung residency training area for you, then maybe you can take a chance. Ako personally, I won't say na madaling derma experience ko. There were times I wanted to quit, derma pa yun, pero I kept going. So, what helped me was, one, a very strong support system with my family, and of course, knowing your why. I mean, it's very cliche, but that's how you go. There's no way to go but through it talaga sa residency. So, if you're still thinking, maybe, yun na nga, you can try to do a pre-res or at least see how it goes. No? If you don't like it, at least you try it, diba? Kaysa naman, you will never submit an application and always think for your entire life, what if I went to residency? Ganon, diba? So, that's my advice. But again, if you feel na hindi pala para sa'yo, like, it's okay. It's not something na you have to do. No, there are many opportunities outside of residency training naman. No, so it's really up to you how you'll make the use of your medical degree.
What was your why?
Siyempre naman, I really found fulfillment sa mga derma patients ko. When I was thinking of quitting din nga actually, I was thinking, bakit ko ba gusto mag-quit? And I realized, it's not because of the patients. I really enjoyed helping my patients. It was more of yung mga ibang mga admin work, syempre mga buhay resident, diba? Pero na-realize ko, I found fulfillment and joy in helping my patients. Iba talaga, like, I think one of the most rewarding things in dermatology, you will see talaga kapag nag-improve sila. And you will see the dramatic improvements sa pimples or sa skin rashes. Even I have patients, the entire body, red na red, or yung daming blister, and then nawala. Nakatuwa. So, that was my why. I really wanted na more people have access to quality skincare and skin health because nga, this is something that is not pampaganda lang. We really deserve this because the skin is the biggest part of our body. So, that's why I kept becoming a dermatologist. Ayun.
I agree with that, yung fulfillment of becoming a doctor actually.
Yes, of
yung
course.
being able to treat your patients and making them happy, and then after i-greet ka nila, hi doc, okay na ako, nakakapaglakad na ako. Hi doc, nawala na yung mga pimples ko and all. It's the best feeling. Siguro you can take me now. Okay na ako dun kung nagagawa ko yun. Like, every day parang I get to experience healing or touching the life of someone. Siguro is one of the best feelings ever.
It's very humbling.
It's very humbling, and parang it's a profession that touches people's lives talaga. So, very noble profession. So, I'm thankful rin na naging doctor ako.
Yes,
mahirap siya.
Mahirap talaga.
Mahirap. Wala namang madali.
Hindi ko ulitin.
Although ako din, hindi ko ulitin.
Ayaw ko
pero,
never.
pero masaya siya. I mean,
naman.
it's worth it.
Yes.
Nakaka-proud sa self mo.
Yes,
like, you were once students, medical students.
Lang, natutulog tayo sa klase.
Ako, sure, natutulog talaga ako sa klase.
Ako din.
No, we were once clerks, interns.
Yeah.
We were once pre-residents. Now you're a diplomate.
Yes.
Now I'm a second year resident.
Malapit na yan.
Yeah. So, siguro important yung sinabi mo about choosing your why or like knowing your why.
Yes.
Kasi you have to go back to that why. Yun yung paghahawakan mo when you want to quit.
Yeah.
Personally, I transferred residency.
Yeah.
So, dinecide ko talaga kung ano yung gusto ko. And now that I transferred, parang mas defined na kung ano yung residency training. Mas masaya ka. Like nararamdaman mo kung ano talaga yung path mo. So, if you nag-quit kayo or anything, okay lang yun. At least you find your spot talaga. Residency may not be for you or residency may be for you. Parang ang realization ko lang in residency is hindi ka mabobore eh. Napakarami mong napaka-broad ng topic ng orthopedics. Napaka-broad ng topic ng dermatology. Magsa-subspecialize ka pa. So it's a constant learning. So I think in all aspects in life, parang it's a constant learning. So kung mahirap yung ginagawa mo, dapat lang kasi
dapat kaya nga ikaw nag-specialty training, 'di ba?
Kaya ka nga doktor eh.
Kaya nga lisana lahat tayo naging derma o naging ortho, 'di ba?
So rewarding rin siya when you actually passed the diplomate exam. Of course,
grabe 'yun.
So yeah, so thank you Laverne
thank you so much also
for coming to my podcast. Hindi ko in-expect mag-GG ka.
Daming timer, hindi
naman. I just tried to invite you and I'm happy you went. I learned a lot. And
yes, thank you.
I'm sure our listeners learned a lot, and hopefully after this episode, people will start building their habits in skincare and stop believing mga myths and misconceptions and be more wary of mga things online. So, if people want to book a consultation with you, saan kanila hahanapin? Where will they find you?
I have a Facebook page. I forgot the name. But it's Dr. Verne Espiritu. Or you can go directly to my Hermoso Espiritu Dermatology Clinic Facebook page. So, yun naman, the contact details are there. I also have a TikTok, Laverne Derm, IG is Laverne Derm also. Puro Laverne Derm, no? So, basta I'm everywhere. Hanapin mo lang Laverne. I mean, it's medyo unique name naman. So, just look for that. I'll reply because ako lang nagmamanage ng lahat ng pages na yun. Mabilis ako mag-reply naman. So, yun.
So, message him if you have any concerns derm-wise or anything you want to ask him after this episode. I hope you learned. Thank you for watching and thank you, Laverne.
Thank you so much, Doc Miko. Doc Miko talaga. Thank you. Thank you, Miko.
Okay.
Yay.